Welcome. Thank you for joining us today. I'm Anne Marie Medina. I'm the Executive Director of Corporate and Community Relations for the University of Arizona Health Sciences here on our Tucson campus. I'd like to introduce Caroline Berger, who is our director up in Phoenix, and also Allison Otu, who is our Executive Director. We really appreciate you joining us today. We apologize for any incidents you may have had with logging in. We did not realize that Zoom changed all of our links for us. So we hope you got the new link, and we'll make sure to get the correct ones out moving forward. We will be leaving time for questions at the end, because I'm sure you'll have a lot of questions for our presenter today. She's going to present for about 20 minutes, and then she will leave time to answer all of those questions that you have. So if you have a question, just put it in the bottom of the chat box at the bottom of your screen, and I will make sure and ask Allison all those questions at the end. Again, don't forget, we're going to send out that post-session email. We'll evaluation for you on it. We appreciate you answering all those questions. We will provide you with all the links and resources that will be talked about today. We'll also provide a link to the video in case you want to go back and watch the session over again. And it'll also have a link to any past sessions that we've had so that you can go back and watch those over again or see any ones that you've missed. So I would like to introduce you today to our speaker. Dr. Coelho is a graduate of the California School of Professional Psychology at Alliant International University, San Diego. She completed her APA internship at Oakland Psychological Services in San Francisco and her fellowship training at the San Diego Psychoanalytic Institute. Her areas of professional interest include trauma-focused psychotherapy, psychoanalytic psychotherapy, military psychology, and neuropsychology with a focus on the impact of traumatic brain injuries. Dr. Coelho also has a special interest in couples therapy with an emphasis on interracial marriage. She has practiced as a licensed clinician in both Arizona and California. Most recently, Dr. Coelho worked as a civilian contract psychologist at Davis-Monthan Air Force Base. Her personal interests include traveling, spending time with family, and writing. And I'm very excited to hear from Dr. Coelho today. Welcome, Allison.
Thank you so much. Thank you, everyone, for having me. Do you want me to go ahead and jump right in?
Yes, go right ahead and share your screen and jump into the session.
Right. So I'm going to go ahead and share my screen here. Okay, so today really our main topic of conversation is going to be the effects or the impact of social isolation on mental health. As all of you, I'm sure, are well aware, COVID-19 has really caused us to experience significant social isolation while we're trying to keep each other safe and healthy, and continuing our functional way of life, while also maintaining a semblance of sanity, given that COVID-19 has really thrown a monkey wrench into all of this. So first, I'd kind of like to talk a little bit about exactly what social isolation is. Interestingly enough, there has been quite a bit of debate amongst psychologists, psychiatrists, neurologists, people in mental health, about exactly what social isolation is. And based on what we can see, these are kind of the two main definitions. Social isolation is a lack of social connections. The CDC likes to keep things rather broad, whereas more specific studies have really identified that social isolation can be the absence of the ability to reach out to people, to connect to family, friends, and sometimes society as a whole. As we said, one of the ways that I really like to think about social isolation is social isolation to me is more of a construct, in that it's a situation, an event that happens. However, there is an emotional expression of social isolation, and most people generally think that loneliness is the emotional expression of what happens when we feel isolated from people. one of the interesting things about loneliness is that it's sort of this tricky space because you can be isolated from people and feel lonely. But there's also that age-old saying of, I'm feeling completely lonely in a crowded room or with my family and friends. And that's more of an emotional, depressive state. So there, like I said, there's a lot of debate in the psychological community about exactly what social isolation is and whether it's the mental health issue or whether loneliness is. So that's just something I like to kind of point out and think about. And I thought our little cat picture would be a perfect expression of what we've become as a result of some of the social isolation that we're experiencing. So given that we have at least a basic definition of social isolation, let's talk a little bit about what happens to us as a result of loneliness that we might experience in social isolation. Sometimes we have sort of the teenage response of, let's take as many memes or as many selfies and see what people on the internet are going to say to us. However, one of the most interesting things that has really come out in the more recent research is that social isolation and really loneliness affects us on a physiological and a psychological perspective, which is something that originally people weren't necessarily sure of the efficacy of that. The area where we really started to see this was in our older population, people that were in homes for assisted living, things like that, where people who had poor outcomes were generally not able to connect with their family members, or their social circle was dying off due to age-related issues. So what does social isolation really have to do with loneliness and how it's impacting us? Interestingly enough, some of the more recent research that has come out is the CDC is really identifying that 36% of the US population is currently reporting clinically significant symptoms of depression and anxiety. And I want to really highlight that word, clinically significant, because it's something that we're going to talk about a little bit later and is really important for us to think about, because we want to really separate the difference between what is a clinically significant issue versus typical or normal emotional experiences. In addition, there are also staggering rises to national hotlines, and more recently, we've also seen about a 34% increase in people seeking out their primary care physicians or psychiatrists or doctors asking for anti-anxiety medication. So it clearly tells us that social isolation, and maybe more specifically, this feeling of loneliness, is causing us to do appropriate and healthy things like reaching out for help. Talking a little bit more about the psychological impact, I want to focus your attention really specifically to executive functioning. What is executive functioning? Executive functioning is really the aspects of our brain. It's this prefrontal cortex area that really gives us the opportunity to do things like problem-solving skills, processing information quickly, or adjusting, set shifting, being able to multitask. When we're feeling lonely, when we're feeling more depressed, when we're feeling more isolated, these things become much, much more difficult. And so the same thing happens with working memory, right? Our ability to remember information, to hold on to little bits and pieces of information that we then have to manipulate. The best way I can describe that is really, I give you a list of numbers and I tell you to hold those numbers in your mind and put them chronologically. That takes a lot of mental effort. And when we're feeling depressed, when we're feeling anxious, when we're feeling withdrawn, when we're feeling socially isolated or lonely, those things become so much more difficult because our brain power is going to so many different other areas. And mood lability is really when our emotions just kind of bounce back and forth. Something that most people are seeing, at least most of my patients are sharing at the moment, is feeling this emotional pull between social isolation and societal stressors that are going on in our country on a given day that changes from minute to minute based on what media is really portraying. And interestingly enough, here's some of our consequences of social isolation. And I figured our puppy dog is the best way of explaining this. Things that really affect us is when we kind of go overboard. More often than not, consequences of social isolation or loneliness is trying to make ourselves feel satisfied. We do that by drinking more than we normally would, by binge eating, by seeking out substances, both recreationally and sometimes also by taking medications that are prescribed a little bit more than is recommended when it comes to doses. It's sort of this very easy, slippery slope. Risk-taking behaviors. One of the most common things that we're seeing at the moment is really people who are feeling so restricted and so out of control, fighting, maybe even wearing masks, or being so easy to get angry, easy to get upset, or just withdraw altogether, right? Wanting to step away from the spotlight, or even engaging with other people and isolating because it's so overwhelming. This is probably the most important message I have to really share with you today. This concept that distress is distressing. If it wasn't, we wouldn't be feeling the way that we are. And so really remembering, sometimes we have society's belief system that there is a right way and a wrong way in which to handle stress. If there was a right or wrong way to handle stress, then people wouldn't be feeling some of the things that they're feeling, right? So this is what's most important, is I want you to really remember, if our belief system is that we're supposed to handle stress well, honestly, we might as well be going around saying, hey, let's be really good at getting divorced, or let's be really good at breaking up with people, because that's something we want to be good at. So really thinking about this process and assigning judgment where it belongs and removing it where it doesn't. There are many, many emotions when it comes to social isolation, being forced to do something, that there are normal and appropriate emotion expressions, things like sadness, things like anger. And so here are just a basic list of emotions that we would typically see when people are struggling. As I mentioned before, I really wanted to highlight clinically significant. One of the things that makes something clinically significant is if it affects your day-to-day functioning. Most of us are incredibly resilient people, and so our sadness, our anger, our frustration, our irritability, our anxiety are just normal, typical emotions that we experience. And they're healthy. We're supposed to be feeling those things. It's when they move over into this area where it affects your day-to-day functioning for extended periods of time, and I'm talking weeks, sometimes months, sometimes years, that becomes a clinically significant issue. And that's where seeking professional help might be more beneficial, right? Remembering there is normal emotions that are anxious, anger, sadness. We're supposed to be experiencing those things. And that brings me really to wanting to talk to you about the role of the role of resilience in emotional expression and in social isolation. Interestingly enough, I really thought talking to you guys about data fallacy was going to be really helpful in this area, because you and I both know we are so incredibly bombarded by statistics, by numbers, by charts, and you just kind of see the red line keeping on going up. One of the things we've actually learned is that there is such a thing called data fallacy. The data fallacy is really a very interesting psychological process. It is the process by where we think if we collect more information, if we get more information, then we'll actually have answers to the stress that we're experiencing. We'll have answers to the problems that we're experiencing. Interestingly enough, that's actually not how it works at all. the more questions and the more data you have, it actually ends up being the more questions you have, and the less likely you are to come up with a functional answer. Because all of a sudden you're seeing all of these outliers that are weird symptoms. Like, for example, of COVID, we have sort of our standard symptoms, but now I'm having patients come up to me and saying, well, the standard symptoms are kind of this, but I'm also being told that there are these like weird, odd symptoms, and I've been noticing I have them more. So I think I have COVID, right? It's sort of this exaggerated, the more information I have, the less likely I actually end up with an answer to what I'm experiencing and what I'm going through. So putting down the cell phone, totally acceptable. Turning off the news, I know, totally acceptable when you're overwhelmed, overstimulated. Because again, sometimes the more information you have, you're not actually ending up with an answer, you're ending up with more questions. That, interestingly enough, makes you feel more out of control in a situation and increases your anxiety, it increases your depression. And that's how symptoms keep getting maintained, right? Rather than us going back to that resilience stance. So again, reminding us as human beings, we're incredibly, incredibly resilient people. And we can handle just about anything. I thought I would put together just some lists of self-motivated versus professional areas of ways of overcoming loneliness, reminding ourselves that for the most part, we are capable of handling the stress of loneliness on our own. And there are only certain instances where you need to seek professional advice, where you might want to see a therapist or your primary care physician or a psychiatrist or somebody in the helping professions. And more importantly, I really want to draw your attention to distraction. Most of us are told, don't distract. Distraction's not effective. It just means you're avoiding a situation, right? Distraction's actually a really effective tool. It just can't be the only tool in your toolbox. And that's what's most important. There are so many different tools that we can use. One of the things, actually, I was showing this to one of my patients, and she's a young adult, teen moving into young adult, and was like, Dr. Coelho, how come you didn't add video games to this list? Video games work because I can be socially connected to all of my friends. We can do our little chit chat while playing our game and still doing something socially acceptable. So that being said, I will add video games to the self-motivated areas that you can actually utilize on your own. A couple weeks ago, I was reading an article on the qualities of resilient people. And I actually thought that this would be something really helpful to share with you guys because, again, my job as a psychologist is really to promote your own inner resilience, to help you recognize the things about yourself that you probably already do. It's just that the bombardment of negative influences and messages is getting in the way of you being able to access those common sense goals and processes. So here are some interesting things that people who are resilient in their nature typically tend to do. Most of them tend to focus on the big picture. While they are detail-oriented, they know the details, and the goal of the details is really to get them to that big picture. So they're able to moderate and mediate between focusing on specific information and how that fits into a big picture. People who are resilient are generally very open to new perspectives and opportunities. And in doing so, they also really know their own blind spots. For people who are resilient in nature, they already know their own areas of strength and areas of growth because they know everybody has them. And so they're able to approach that from a non-judgmental stance. And they're help-seeking. When they're struggling, they reach out to people. They know their own limitations. And here are some more qualities that I thought are helpful. People who are resilient are actually quite okay with spending time alone and by themselves. because that's their way to reflect. They're able to hear their own thoughts and be able to sort of reflect it against societal's information system and be able to ask those questions. Am I really okay with this? And hear themselves think. That's a really important space, especially given how bombarded we are with information. They value and they build relationships with people because being with people matters to them. At the same time, when they are building those relationships in a period of social isolation, when they do have relationships with people, they're able to maximize their time together and absorb as much energy from that interaction so that they can make it last a longer period of time. They plan some more, and then they back up plan for their original plans, right? That's something that people who are generally resilient know. They kind of know this process: make a plan, execute the plan, expect the plan to go way haywire, make a new plan, right? That's just kind of the way they tend to function. And most of us do this all the time without really even realizing we do it. And they practice self-care. The 75% rule is actually something that I really wanted to focus on with you guys, both from a parenting standpoint and an individual standpoint. 75% rule is something that came out in early psychology, where we were trying to figure out how much effort somebody had to put into anything: parenting, a relationship with a spouse, occupational stressors in general. Most of us come from the belief system. Again, there's that belief system piece that we are supposed to put 100% of our effort into everything. Unfortunately, what that really does is set us up for failure, because if we're putting 100% into something, if crisis happens, if catastrophe happens, what excess energy do we have to deal with that? We don't. And that's how we end up more drained and more likely to end up having a mental health disorder, is because we've exhausted all of our psychological resources. So doing 75% actually keeps you with a 25% buffer. And this is something healthy to even teach children. If parents give 100% of their time to their children, children don't learn to self-soothe in the most effective ways. And so really learning that 75% golden rule space can be something that's really helpful with rebuilding your, what we call psychological coffers, or your psychological resources. And I really love this cartoon character because people who are resilient focus on conserving their energy, and they are incredibly innovative. When they're able to retain some of that energy, they can put into creating more effective uses of their energy. And in doing so, as Dinosaur says, I'm unstoppable, even if I have my little clicker. And in general, they also look at challenges with a stance of gratitude, knowing that they will learn something from the difficult experiences that they have, and therefore be able to utilize their resources more effectively moving forward. Here's a list of some of the resources that I used just to get through some of these presentations. So if you would like to make a note of some of these, they're great resources to be able to reach out and do your own research on and remembering how resilient you actually are. And here's my contact information. And just to remind you, stress spelled backwards is desserts in moderation.
Thank you, Allison.
All right.
If you want to go ahead and stop sharing, there we go. We do have some questions. That was wonderful information, and we'll talk in just a little bit about your upcoming sessions that I think people will be very interested in. But I did want to ask a couple of questions from the chat box. Would it be on track to say that issues with addictive behaviors are more prevalent during quarantine?
Yes, one of the main reasons that they're more prevalent is the typical resources that we would use to distract ourselves end up kind of going out the window. This is something that has really happened with COVID-19 is people who generally work out more, people who tend to externalize their resources, all of a sudden lost that ability to do so. And then their ability to connect with their resources went out the window. So they kind of panicked and went back to doing more addictive like behaviors. So yes, remembering, as I've always said, as many tools in the toolbox, what's necessary, rather than just one or two typical things that we go to.
Okay, great. What are your thoughts on participating in support groups to help with connecting with depression, things like that?
Do as much of it as you can. Right now, almost all the clinical organizations in town are really doing support groups virtually, so you can still maintain your safety. And again, remember, social distancing does not mean don't socialize ever at all. Using your common sense, reaching out to people who think the way that you do or who are taking this as seriously as you are, those are your support systems. Those are your friends. You can trust that when you walk into their home, they're still taking the same level of precautions that you are. It doesn't mean nope and never.
And another question, how does your daily intake of vitamin D impact your moods or depression?
That's way more of a medical question.
Okay.
Typically tend to answer. And so I would recommend talk with your providers, your prescribing providers about the impact of vitamin D. Most of us know vitamin D definitely helps with energy boost. So I would recommend talk to one of them.
Okay. Wonderful. We had talked about, you mentioned, self-care and taking care of yourself and the importance of learning how to spend time alone. And I find that, every morning I take a walk in my neighborhood, which I'm out in the middle of nowhere. And so I can walk with nothing but the coyotes. But, my husband always says, isn't it too hot? And I said, it doesn't matter. That is time for me. That's how I get my mental calmness and things. So I find that spending time alone is very important, and teaching children to do that is very important. So I'm glad you mentioned that. I wanted to move on to our next slide because I wanted you to talk about the upcoming sessions that you have. So I'm going to share my screen again, and we'll get to this slide. So if you want to talk about your upcoming webinars from the Learning Institute.
Absolutely. So just for you guys to know, we always really putting together an amazing resource and conversation about the impacts of mental health and the impacts of family. If you like some of the information that I've given you, I kind of touched a little bit more on the impacts of mental health, but really my area of focus for this conversation is the July 24th program on couples and family systems. So it's really going to be me and Dr. Ranjabar talking about how social isolation has impacted our family structures, our marriages, our interpersonal relationships, and kind of figuring out different ways to resolve some of the conflicts at home, because I think all of us have quickly realized our spouses' annoying behaviors have really kicked in, right? It's kind of amazing.
Yes. Wonderful. Well, we will make sure and send the link out for those two with all the information on those upcoming sessions, and there will be an automatic link so you can register for them. So we hope you'll take advantage of them. Allison, thank you so much. This was wonderful information. We really appreciate you participating today.
Thank you so much for having me. I really appreciate it.
So next week, don't worry. We've got another great session coming up, and this will be Dr. Laura Gallinat, who is with our Department of Family and Community Medicine, and she is going to be talking about the amazing healing properties of food, from squelching inflammation to maintaining a healthy weight. So make sure that you sign up for that one, and that'll be our next session. So on behalf of all of us at UArizona Health Sciences, be safe, be well, bear down, and mask up. Take care, all.